Okay, so once you suspect the patient might have TIA and he is near to developing a stroke, what will be your steps in preventing that stroke to happen? So your step 2 will be always to act, and you will think about admission. So in ACT, you have to always search for the ABCs and vitals. You have to do this part. Check the BP, you have to check the glucose, and you have to take the rapid history to know where the patient's onset of time. Sign and symptoms is most important. It had sudden onset, rapid onset. Patient had any vision loss, had any numbness, any weakness in any limbs and speech difficulty. What was the duration, how much long the patient had that problem, and what are the risk factors. But the most important part here is urgent investigations in first 24 hours. You need to do this. Non-contrast CT, you need to rule out for hemorrhage, and most often they are normal in TI. Don't forget that. If you found a normal CT scan, you cannot rule out. You need to do brain MRI with diffusion weighted imaging, which will detect silent infarcts. So this is our most important steps to do. In next 24 hours, you can do, because you will do the ECG at the beginning, and you need to do echo and carotid Doppler. That's the most important labs you need to do. And once that has been done, then you need to stratify the patient on which will decide the admission for the patient, which is known as ABCD2 score. A is for age. If it is more than 60, 1 points. B is for blood pressure. If it is more than 140 by 90, 1 point. Then clinical symptoms like patient has weakness is equal to 2, and patient has speech has 1 point. Duration more than 60 minutes have 2 points. If duration is less than 60 minutes, then has 1 point. And diabetes mellitus, 1 point. So if it becomes more than, the score becomes more than 4, you need to admit. You need to admit because the patient is high likely to get the stroke. So you need to prevent that stroke. So if the score comes 4 in ABCD2 score, you need to admit the patient. But one thing you have to remember, that if you did the CT and the CT comes normal and you forget to do the MRI brain with TWI, remember the patient can have posterior circulation infarct, and for it you don't need to do the ABCD score, because the posterior infarcts most likely they are silent. So you need to have this in your mind.